Good afternoon, everyone. I'm Jess Correa, a mental health specialist and wellness specialist at Rutgers University Behavioral Healthcare, and I am excited to welcome you all to our Fire and EMS webinar, which is part of our Wellness webinar series. The Fire and EMS Lifeline is a peer support program and helpline that works to support firefighters, EMTs, and 911 dispatchers. We will be recording this webinar for those who were unable to attend. Even if your camera is on, your picture will not be displayed in the recording. However, if you'd feel more comfortable being off camera or changing your name, we'll give you a minute to do so before we go ahead with the recording. First off, I would like to thank you all who have taken the time to join us today. We have designed this webinar to learn more about each and every one of you and how our program can better support your needs. As I mentioned, this webinar is part of our Wellness webinar series, where we will be learning more about the 8 dimensions of wellness developed by Dr. Peggy Swarbrick. These webinars will give you an opportunity to learn more about wellness and tactics you can use while at work to help build your resilience. The New Jersey Fire and EMS Lifeline is part of the National Center for Peer Support at Rutgers University Behavioral Healthcare. Our peer support program utilizes the reciprocal peer support for wellness model to provide peer-specific support. So when you call in to speak to someone, we can assure you that the person answering your call comes from a similar background as you. On your screens, you'll see our program flyer, which may look familiar if you've seen it around your workplace. We encourage you all to take a picture of this flyer, which highlights all of our important information. I'll give everyone a minute or two to jot down or save our phone number in their cell phones or take a picture of this flyer. Even if you may not be in need of our services or support at this time, you never know when someone at work may benefit from our assistance. We are joined today by the Fire and EMS team. I'd like to take a quick moment to introduce you to our New Jersey Fire and EMS Lifeline peers and administration. We have Cherie Castellano, the director of our program and the director of the National Center for Peer Support at Rutgers, and our peer support specialist, Judy Shouty, Alan Finkelstein, Kelly Montesano, and Steve Holmes. Some of our peer support specialists have joined us today and will be introducing themselves further in the chat. We would also love to hear from you and invite you to introduce yourselves by telling us your name, your position or job title, and what department you're representing in the chat. Our mission here at the New Jersey Fire and EMS Lifeline is to provide peer support for firefighters, EMS, and dispatchers. Our team is comprised of peers who are retired and active firefighters and EMS professionals. They understand the challenges you face every day on the job and can relate to your stressors. Our services at Fire and EMS Lifeline include peer support and telephonic peer counseling, clinical assessment, including prevention, intervention, and postvention, critical incident stress management available throughout the state, resilience and wellness training, and access to our fire, dispatcher, and EMS specific network and resources. At the Fire and EMS Lifeline, we have built on the foundation of the wellness approach to resilience based on Peggy Swarbrick's 8 dimensions of wellness, which have been adopted by SANSA. We have identified this as a key model to self-care. And although we would love to spend time focusing on each dimension today, we will only be focusing on occupational wellness. Occupational wellness is the personal satisfaction and enrichment derived from one's work. Occupational wellness can also be defined as the pursuit of career options that are personally meaningful. On your screen, you'll see some tips to help promote and encourage your occupational wellness. It is important to explore career options, ultimately, finding a career that is most fitting and is of interest to you. Thinking about your future and taking your time to assess what you would like your career growth to look like in a few years. Having strong occupational wellness also involves promoting work life balance. Take breaks, prioritize your health, and make time for things you enjoy to do outside of work. Find benefits in your current position and explore the positives that your current job has to offer. And lastly, build positive relationships at work by practicing mindful listening, scheduling time for social interactions, and being positive. Now we're going to hear from Alan, one of our peers at the Fire and EMS Lifeline. He'll be giving us some more insight on occupational wellness and how he has prioritized it during his career as a firefighter.
Thanks, Jess. Having spent 34 years doing fire and EMS work before retiring and working on the fire EMS line now, I've realized how important occupational wellness is for me. I feel that we must have balance in our lives if we don't want to burn out on the job. We need to find ways to cope with the stresses and strains of our sometimes very difficult work if we want to be as healthy as we can. Family, recreational time, spiritual practice, and other non-job related interests are necessary to maintain our physical and mental health. Being focused on your job is very important, especially given the fact that people's lives are very often in your hands. There's nothing wrong with being laser focused on your job, but by the same token, if we don't take the time to explore the other sides of our lives, we can dull our very necessary attention to what we do at work. Maintaining our skills and competencies is obviously something we must do if we want to do the best job possible for our patients. However, it never hurts to go outside your comfort zones and learn new skills or to broaden your horizons by participating in non-job related activities. It's also very important to maintain a positive attitude on the job, as well as maintaining a good level of interaction with your coworkers while you're there. When I was in the fire and EMS service, I always tried to stay involved in activities that weren't related to my career. That included going camping, traveling to unusual places, or even just taking a couple of hours to sit and read a novel, or try to be outside and just appreciate nature. I felt that kept me sane and able to devote more time and energy to my job when I was on my shift. It seems to me that our minds are designed to have many different experiences, and taking advantage of different opportunities makes the most sense to me in terms of keeping our minds open and fresh.
Thanks so much, Alan, for sharing those helpful tips and a little bit more about your experience. Now we're going to get an idea of how your occupational wellness is doing. We'll be taking a quick occupational wellness quiz. So grab a piece of paper and a pen if you can and jot down your answers as I read through the quiz questions aloud. There's a total of 10 questions regarding what you do to maintain your spiritual wellness, and the scoring scale is from 1 to 4. I will read each statement, and you can jot down how often you engage in the activity being described. 1 being rarely, if ever, 2 being sometimes, 3 being most of the time, and 4 being always. All right, the first question is, I balance work with play and other aspects of my life. You'll write down 1 if rarely, if ever, 2 for sometimes, 3 for most of the time, and 4 for always. 2, I take advantage of opportunities to learn new skills, which will enhance my future employment possibilities. Number 3, I know what skills are necessary for the occupations I am interested in. Number 4, I strive to develop good work habits, punctuality, dependability, and initiative. Number 5, enjoyment is a consideration I use when choosing a possible career. Number 6, I work effectively with others. Number 7, I am developing the necessary skills to achieve my career goals. Number 8, I have confidence in my job search skills, resume writing, interviewing, etc. Number 9, I have explored different career options. And lastly, number 10, I know where to find employment if needed, job service and online resources. All right, let's take a couple moments to add up those scores. The highest score you could get is a 40. So if you're close to 40, you can congratulate yourself for prioritizing your occupational wellness. Or if your score surprised you in any way, take a minute to reflect on the questions and see if there's any specific area that could use improvement. I'll leave this up for another moment before we go to the next slide. Next, we'll be sharing a video about how to find both purpose at work and in your personal life.
Gordon Graham here with today's tip from Lexipol. And today's tip is for everyone in public safety. And it has to do with finding purpose in your life, something that can dramatically improve your mental and physical health. Some of you will probably know that I love to talk about blue zones. There are several areas in the world where people tend to live longer and healthier lives. Okinawa, Japan is one of those places. And one of the secrets to their population's longevity is something they call in Japanese ikigai. That is a term that refers to a person's reason for living. And people who have a clear ikigai tend to live longer, happier lives. So how does this translate to those of us working in public safety? Our professions already have a purpose, and that might be why you joined. We work to serve, protect, and help others. This is true, but work is only one part of your life. And when you retire, those organizational purposes are not going to be there to keep you motivated. So what is your personal reason for living? What purpose will keep you going now and throughout the rest of your hopefully long life? I want to propose a tool that can help you find purpose in life. And you're not going to believe that I'm saying this. That tool is called a bucket list. Now, you may think I'm oversimplifying life's purpose by suggesting it can be reduced to a bucket list. But most of the examples of ikigai are simple things like tending a garden, regularly visiting neighbors or relatives, finding a new hobby, or learning a new skill. They are things that people do to bring themselves joy and adventure, to enrich their lives and the lives of people they care about. Isn't that what a bucket list really is? So please make yourself a bucket list. Write down things that spark your interest or ignite a passion. Add items you think might lift your spirits and ones that might brighten the lives of those you care about. And when times get difficult, and they do, take a look at your bucket list. Pick an item and get to work on chasing after that purpose. Remember, life can be short. So use a bucket list to intentionally add joy, peace, and purpose. And that is today's tip from Lexipol. Gordon Graham, signing off.
All right, let's take Gordon Graham's advice and focus on creating a bucket list. I'll leave this slide up for a few moments so you can take a picture of it and work on it at your convenience. But I do want to take a few moments to have you all think of something you'd like to add to your bucket list and share it with us in the chat. Our peers will be monitoring the chat as those answers come in. Leave this up for a minute so we can do that. All right, I see some answers coming in. And as I mentioned, our peers are interacting in the chat as well. So keep those answers coming as we move on to another video. As mentioned, another great tip to enhance your occupational wellness is to slow down, which can ultimately help you avoid burnout at work. Let's hear what Mr. Graham has to say about slowing down in the workplace.
Gordon Graham here with today's tip from Lexipol. Today's tip is about 2 words: slow down. Please slow down. You know what I've learned over 45 years? Cops, firefighters, correction people are odd. ODD. You are willing to take risks that most people would find totally unacceptable. You know what else I've learned in 45 years? There's another oddity in the brains of cops, firefighters, correction people. Everything needs to be done now. I got to do it now. I got to do it now. The purpose of this tip is please slow down. Whether you're in the fire service, in the cop world, or a custody setting, we all share one thing in common. Someone asks us for help and we respond. Whether you're leaving the fire station, heading from a cold report to an emergency, or walking to an inmate's cell, we've got one chance to get it done right. We've also got something else in common. We're always pressed for time. We've got tasks waiting. It is so easy to be distracted by other pressures. Dispatchers keep broadcasting new requests for service. Calls are backed up. Supervisors seem to want things done quickly and efficiently. Paperwork stacks up. Our cell phones are a constant nuisance. You gotta feel sometimes like you gotta get through one call to get to the next. But I'm here to tell you, ignore this and, you guessed it, slow down. I hear many stories about firefighters, cops, or corrections officers who handled the calls efficiently, but not effectively. That means they arrived, learned what was wrong, and they cleared the scene quickly, ready to go again. But they failed to solve the problem. One example is the gas leak reported by a citizen. The fire department shows up, conducts a cursory evaluation, and can't find the problem. So they clear the call, and an hour later, there's a gas explosion. Or cops arrive at the scene of shots fired in an area. They drive through, they fail to find the gunshot victim. We've seen suicides in jails where deputies didn't take the time to hear what an inmate is trying to convey. These things don't happen, or happen less frequency, when we slow down. In my world, traffic. How many times? We got a vehicle over the side and the cops drive through, they don't see anything, and 3 days later they find the car down the side of the hill. Skid marks going right over that they missed. Slow down. I will tell you this, every call you get is unique. Whether it's an inmate asking for assistance or a person reporting a fire, each call should be thoroughly investigated. That's what you signed on for years ago. That's what you've trained for. It's what's expected of you by your peers, your supervisors, and your public. Slow down. Actively listen to all available information. Consider potential problems that might arise. We all have distractions and pressures that can hinder our focus. These may cause us to hurry through calls for service. We can miss details or overlook indications of serious problems. Distractions and pressures are real. I'm not discounting them here. I'm simply asking you to try to set them aside. Focus on what you're doing on this call. Slow down. We can be both efficient and effective, and that's how we do our best work. And that is today's tip from Lexipol. Gordon Graham signing off.
Those were some great tips and reminders to slow down, take your time at work and in your personal life as well. Slowing down can ultimately reduce the impact of burnout. But let's talk about some symptoms of burnout because sometimes it's not always inevitable. Burnout typically has three major symptoms: exhaustion, lack of engagement with or withdrawing from the workplace and coworkers, and a negative attitude towards others and their personal goals. These symptoms can manifest in many ways, including poor job performance, poor nutrition, difficulty concentrating on everyday tasks, poor or ineffective sleep, nightmares or flashbacks, loss of interest in normal activities. Burnout is surprisingly common. Nearly half of all firefighters in the US are likely to experience burnout and the health problems that accompany it. But there are things that fire and EMS professionals can do to help avoid burnout. Some of these symptoms may be inevitable as a first responder, so let's talk about some ways to fight burnout. Individually, EMS and fire professionals can incorporate a variety of practices in their lives to help prevent burnout. These include practicing mindfulness, meditation, or yoga, maintaining a consistent, enjoyable exercise routine, prioritizing sleep, talking to supervisors and families at the first signs of burnout, developing hobbies like baking, gardening, writing, painting to maintain a positive work-life balance, setting attainable professional goals to challenge yourself, seeking additional support through friends, family, and professionals, taking time to totally disconnect from your job by taking a vacation or turning off your phone. As you develop healthy habits that provide you with time to decompress, you'll find you have more energy at work and at home. And if you are feeling any of these burnout symptoms and are unsure of how to navigate them or just want some support, please reach out to our peers by calling the number at the bottom of your screen. We are here to help you. As we wrap up, we wanted to share some research articles and statistics with you all to show that your professions are undoubtedly stressful. And even if you aren't currently in any need of support, someone you work with may benefit from knowing about our services. 19% of firefighters have experienced suicidal thoughts. 27% have struggled with substance abuse. 65% are haunted by memories of traumatic work situations. And more than 80% of firefighters said they felt that asking for help may make them seem weak or unfit for duty. 49% of EMS self reported burnout, with 43% suffering from work overload and 38% experiencing anxiety or depression. And in 2020, there was an 18 to 24% of 911 dispatchers that reported enough symptoms of PTSD that they would likely receive a diagnosis if they were seen by a psychologist and formally evaluated. The New Jersey Fire and EMS Lifeline has adapted the skills presented in the 8 dimensions of wellness to give you a better understanding of your overall wellness and practical ways and activities for using them in your daily lives at home and at work. We hope that you found these skills useful, and we encourage you to reach out to our fellow peer support specialists at any time for additional insight and support. We are here when you need us. Focusing on your occupational wellness can improve your mood, encourage healthy relationships both at home and at work, and create effective communication. Here are a few important phone numbers to keep handy. Our phone number right at the top, the FMBA, the IAFF, and the Suicide and Crisis Lines, which are the New Jersey Hope Line and the National Hope Line. We also have a chat feature on our website if someone prefers to text rather than talk on the phone. It's easy to access, so you can just go to our website, njfireems.com, click on the chat option, and then click on Chat with an Expert, and you'll be instantly connected to one of our peers. Thank you all so much for joining us. We hope you enjoyed our webinar and learned some new information that you can use, again, both at work and at home. Stay tuned for our new webinar schedule coming to you soon. Thank you so much for joining, everyone. Have a great day.